My topic of interest today is full body liposuction. Hi, I'm Dr. Sheetal Londhe. I'm a board certified plastic surgeon practicing at Zero Size Viman Nagar, Pune. As the name suggests, it is full body liposuction. Lipo means fat and suctioning means taking it out of your body. So yes, how do we address a patient who comes to us who wants a full body liposuction? When a patient comes for a full body liposuction, the first thing that we see is the age, the height and the weight of the patient. What is the BMI is been calculated, and then we decide, yes, the patient is for full body liposuction or some other procedure. Depending on what body parts are to be targeted will be decided in the consultation. According to the science, it says that when we do a liposuction, the amount of fat that should be removed from a patient is only 10% of his total body weight. For example, if a patient is weighing 100 kgs, then I can only remove 10 liters of fat by liposuction. Yes. So it is not that someone comes and says, ma'am, get me rid of this 15 kgs that I'm overweight. No, but if you're 80 kgs, I cannot take out 15 kgs from you. So the calculation has to come into place. And then if that is the condition, then we will break the surgeries into 2 or 3 steps. Like in first stage, we remove the first, whatever your 10% is, and the next we remove then the 10%. So when a full body liposuction comes, we will first see the BMI of the patient. Once the BMI and everything is calculated, we will plan for which body part to be targeted first. If the BMI is too much, that a 10% will not give the result. But usually when it's a full body liposuction, the patient is in the good range of BMI and they only want a good body count. So when that has been planned, we will decide on the day of surgery. Before that, what happens? Your pre-operative examinations, your blood test, your physician giving you fitness and all those things. And your main thing is your 2 consultations with your plastic surgeon, that's me, before the procedure. So what do I do in the consultation? First consultation is very regular. This is the body part that is bothering me. This is the bulk. This is the punch that's been seen in my this dress and that dress, and I'm very fed up. Or my thighs are rubbing to each other. There is friction, and then I have pigmentation and irritation. So we will target the thighs. Once I have decided that yes, these body parts have to be taken care of, this much of liposuction to be done, this much of liters to be removed, is your first consultation. Then we send you back to all the tests that I told you and the physician fitness. Then comes the main day of consultation, where we sit down. All the pros and cons regarding liposuction and the surgery is been explained to you. Then you have a paper on which a thorough consultation and your consent has been taken. After this, we give you the realistic things, what you are expecting. Okay, if I can give you the result, we'll tell you that yes, we can give you the result. But if we can't, then we'll tell you. For example, there are girls who come and who have had a pregnancy 2 to 3 and they have a big tummy and they just want to get rid of it with liposuction. No, I can't. There's a divarication of recti. That is, the muscles are weak. I need to strengthen the core. I need to remove the extra skin. So that's when, the argument or the doubt or the debate or whatever can start. But yes, if we can give, we tell you. If we cannot, we will tell you that also. Then we will decide, and then will be the markings. Okay, from the back hump, this much liters is going to be. And on that is my chart where I will write, okay, from here I will be infiltrating this much fluid. I will be removing so much of fat. The energy of my Vaser machine which I'm going to use, everything will be written on a chart. And then you will be allowed, to see through it, understand from where what is going to go. When we are planning for a full body liposuction, 2 to 3 days before, we'll be putting on a special diet. More of a liquid diet and then of a solid and a high fiber diet, so that you're cleansed of your toxins and everything from the tummy, because we avoid giving an enema. Only by diet you can clean all your intestines. Day of surgery, you're giving an appropriate anesthesia which is required for your procedure, and then the procedure of liposuction starts. If it's back, we finish with the back first, then turn over, then do the tummy, thighs, and all this is all in the OR, for which I will definitely make a different video so that you all can understand about it. After the full body liposuction is done, it is very important that patient keeps themselves well hydrated, because patient is with me for a day or 2. That's when I give the IV fluid and we keep them hydrated. But when they go home, so they should be drinking a lot of fluid, because imagine you are X kg and I remove Y kg from you. This Y kg was supposed to go out of your body over a period of some months, and that has been removed just 2 to 3 hours. So your body needs that calories, that energy, that protein, that fluid to get yourself to stand up and be strong. It's not that you'll be too weak and you'll fall off and you'll have giddiness, but the fluid intake, the calorie intake and the protein intake should be well maintained after the surgery. After the full body liposuction, patient is there in the hospital for a day or 2, then goes home. There are a different type of garments that we make you wear, that's called as the pressure garment, and they are very, 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 very important, because it not only just holds the body in position, but it helps in the skin shrinkage, it helps in reducing of the seroma, the edema, that is the swelling that goes down because of it, and overall you have the comfort in the clothes that you can move around. Yes, when you come for the next follow-up, we will give you a diet chart which will be restriction of calories and more of proteins and more of fiber, and this should be followed for the next 6 months minimum, 1 year maximum, and the rest of your life we would love if you do that, because liposuction is not a magic wand that I do this, you come to a figure and that's the rest of the life. Maintenance is what is very important from the patient's side. So in liposuction, we can remove 10% of your body weight in a go, and it's any body part that can be targeted. From chin can be taken care of, double chin, neck can be taken, arms can be taken care of, tummy can be taken care of, thighs, calf, back, waist, love handles, everything can be tackled with liposuction. But you should have realistic expectations. You should know the pros and cons of liposuction, and you should be a motivated person to undergo undergo the procedure. That yes, after liposuction, I am going to maintain a good lifestyle and keep my results forever. So, if you have any doubts or you want to know what are the pros and cons of liposuction, please visit us at Zero Size, Viman Nagar, Pune.